Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live, and we are at 888-630-9625. That's 888-630-WMAL. The weather is changing. It's gorgeous outside, and you need to go for a walk, and tomorrow even better than that. Don't miss the opportunity to have some fun. We're here to answer your questions on all different types of problems. If you've had a problem and you've tried, you applied, and you've come up with the absolutely same old, well, this is your opportunity to fix it, to turn it around without drugs, without surgery. We have a very special topic today, one that is ongoingly being promoted in the marketplace, ongoingly being put on television as something that is normal, and it's not normal, and the fix is not normal, and it's something that you need to be totally, absolutely, positively aware of, that there is an alternative method. We're going to talk about GERD, Gastroesophageal Reflux Disease. You know, that burning that you get in the pit in your stomach, the one that goes into your chest, the chest pain that looks like a heart attack, the inability to digest things, you know, your stomach blows up like crazy. Well, that's what we're talking about today, but we'll talk about what you want to talk about as well. My guest, matter of fact, I have two guests today, but we're going to take them one at a time. My guest, your presenter this Wednesday night, April the 6th at 7:30 p.m. at the Roselle Center for Healing, is Dr. Leonard Poe. He will be talking about GERD. So if you have a problem with GERD, you've been on medications for a long time, I got news for you. It's tearing you up, and it's causing more problems, and there's a resolution to this. Dr. Poe is going to give you the skinny on how to turn this around without drugs, without surgery. This is an opportunity for you to really make a difference and stop the loss of bone mass that you're getting, the inability to absorb calcium, the problems that you're getting with protein absorption and B12, and the list goes on. And we're going to talk about that list today. Good afternoon, Dr. Poe.
Good afternoon.
I'm glad you're here again.
I'd rather be outside.
Well, you know, I would too. But, you know, two reasons I'm glad you're here. One, you're extremely knowledgeable in the subject that we're going to talk about, and we treat a lot of patients who have that. And more importantly, I need somebody to help me through the program because my voice still hasn't come back. Last week I dropped a bunch of dust in my nose, and it's been a long week trying to get it all back. You know, it's tough to sound sick and not be sick. You know, it's not convincing.
That'll be my pleasure today.
Thank you. I appreciate it. So we're going to put it more on you today. But our number here is 888-630-9625, 888-630-WMAL. Give us a call. Ask Dr. Poe anything you'd like to know on GERD, or ask us a question on any problem that you may be having specifically. We'll be more than happy to entertain that. And I have a very special guest coming up after the first break, somebody who's near and dear to my heart, one of the most brightest in the country when it comes to many different things. This guy was the chiropractic physician for the Kansas City Chiefs for 12 years. He lectures widely. He wrote a book called Stressed Out, Headed for Burnout, and we'll talk to you a little bit more about that as time comes around.
He was the first one that taught me AK.
That's right. He was your mentor.
My first senpai.
You bet, and very well done and very well put. Dr. Poe, tell us a little bit about really what GERD is, and then we're going to talk about how it's misdiagnosed.
Well, GERD has changed names over the years lots of times. If you don't recognize it by the name GERD, it's heartburn, it's acid reflux, it's all those things. And we like to try to give this name of a disease. And there's lots of reasons why, you know, they try to name it that.
It markets better.
Because it markets better, and you got to have a disease to give a drug. But this is not really a disease. You don't go out and catch this. This is not like you went out and you touched the GERD tree and now you have it. This is just poor physiology.
It's a functional problem.
It's a functional problem, and that's all it is. And unfortunately, we end up treating the symptomatology of it far more than we actually treat it for function. And that makes the problem far worse down the long run. You mentioned a lot of those things, calcium absorption, just how we digest food. You know, it's just getting in there and it's rotting in our guts and it's not going anywhere. We're not getting the nutrients we need. And the reality is, and this is the thing, when I see patients that come in and I see, you know, what's the purpose of the appointment, and I see GERD down there, I love it because it's so easy to treat.
It is.
It's one of the simplest things. You know, it's just not hard, but you've got to treat it the right way, and you've got to treat it from a very, very functional standpoint.
You know, there's an interesting situation with GERD that from the first time they decided to position it as hyperacidity in the stomach. They're saying you got too much acid and that's why your stomach is burning. But the diagnosis usually doesn't take place until people are generally much older, right?
Yeah.
And here's the deal. When you're 20 years old, you produce about 6 times as much acid in your stomach than you did when you were 60 years old. So it's like, so what's the deal here? You know, suddenly your body's going to react to too much acid.
Yeah.
What's the problem?
The big thing that you have to realize with that is that by symptomatology alone, it is impossible to tell, do you have too much stomach acid or too little stomach acid? You just can't tell. The symptomatology is exactly the same. And, you know, what we know, though, is, and from what we see in the clinic when people come in, the overwhelming majority of the time, I would say 99.9% of the time, it's not because you're making too much stomach acid. It's because you're making too little, far, far too little.
Much too less.
And the big piece that goes along with that, and the big piece we always talk about, if you have stress in your life, it's going to be physiologically impossible to make too much stomach acid.
You know, one of the things I'll tell my patients, and I relate to them because so many of them have had gardens over the years, and I'll tell them, listen, here's the deal. Do you understand that when you put a garden together, one of the things that makes it grow well is lye, which is alkaline. It's actually the opposite of acid. And they say, yes, I do. Okay, so here's the deal. What happens if you put way too much lye in the garden? What happens to the garden? And they'll look at me and they'll say, it burns out. I said, yeah, exactly. It burns the garden. So when your stomach gets too dry, meaning not enough acid, it burns your stomach.
We look at all those other diseases and problems that go along with that, things like that contribute into it, things like hiatal hernias, things like H. pylori. We know that ulcers now they're caused by something called H. pylori. It's a bacteria, but that bacteria can't live in an acidic environment. So how do all these people with ulcers? How can you say it's because of too much stomach acid? It's absolutely impossible.
You know, they screwed this up years ago, too. They used to do what's called a vagectomy for somebody who had a stomach ulcer. You know, their idea was too much acid. The vagus nerve comes from the brain. It comes down, touches a lot of organ systems. The stomach is one of them. So they felt that if they cut the nerve to the stomach would stop producing acid. It wouldn't burn anymore. Not so much. It would continue the process, and the stomach would continue to break down. But the side effects of this thing is enormous.
That's the thing. When we continue to in mainstream medical society to treat this thing exactly the wrong way, because we're only trying to dampen the symptoms of that uncomfortableness that we have after we eat. And it's real easy. You get the function right again, and the rest, all the food digests properly. And that's the big thing. And I talk to patients a lot about, butterfly effects and snowball effects and how these things build. And when you're not getting the nutrition you need, whether it's because the stomach's not working right or the gallbladder or the pancreas or whatever level the hiccup is there, whenever digestion is not taking place right and you're not getting the nutrients you need, then you can't make new tissue, you can't heal, you can't rejuvenate, you can't rebuild anything. And you get in this downward cycle of degeneration.
One of the most important things people have to understand is the anatomy of that area. The stomach sits underneath this big muscle that cuts the body in half called the diaphragm. And the diaphragm is innervated by nerves that come from the spine. It also has nerves that come from the neck. And we end up seeing the diaphragm tighten in many cases of GERD. And it puts pressure on the stomach, allowing it not to function properly. And often after a car accident or a fall or a blow or people who have habitually slept inappropriately. So there's mechanical dysfunction that causes this condition as well. But in addition to that, we look at diet, allergy reactions, and things that people are putting in their bodies that shouldn't be there, that are setting up the whole microbiological environment of the gut.
When the dysbiosis gets off, when you've got too little good bacteria and too much bad bacteria, or too much mold and fungus, candida, parasites, all those other things that we pick up, we pick those things up primarily because there's not enough stomach acid there to begin with. And when that whole tract gets thrown off, once again, it's taking from your nutrient banks. It's taking from the things that you need to make new tissue. And so it's real easy, and this is why I said I love getting patients with digestive problems, because it's real easy to do. You repopulate the good bacteria, you get the bad stuff out of the system, and you start to touch on that. You get things out of the diet that shouldn't be in your diet. And everybody's very unique with this fact. And often we have patients that come in and you ask them, do you have any food allergies that you know of? And most of the time people say no. But in reality, there are a lot of things in there that you're sensitive to, that you're toxic to, that just shouldn't be in the diet at that time. And once you get those things out and you clean it up.
The interesting thing about allergies is that so many people are allergic to things, setting up that burn pattern because they don't have enough acid. Because if you don't have hydrochloric acid in your stomach, and if you don't have pepsin, you don't have the other digestive enzymes available, it can't break up the food. So the food now becomes an irritation. But more importantly, bacteria, bad stuff that comes in, is first attacked by the normal enzymes of the stomach. And so if those enzymes aren't adequate, you end up in trouble.
And that, it's with digestive problems, whether it's GERD, anything else, there's all three of those pathways that we always talk about. There's the structural component, there's the chemical component, there's the emotional mental stress component. And the structural component for this is a big piece as well. And we talk about cranial function, we talk about, all those things, the temporal bone, how it moves, how it ignites that stomach acid to start in the first place. There's different pieces, but they're all very easy to go through and look and see which ones aren't working right, which ones are working right. Get the ones that aren't working right working better.
Well, a patient comes in and says, well, my doctor did, an examination. They looked down my throat, and the endoscopy showed that I have all this irritation in my esophagus, so I must be back flushing acid. And what I keep trying to tell them, it's not acid. It has nothing to do with that. In a few cases, it is. Now, I'm not going to say across the board that it's never acidic, but it's not acidic in the great majority of times, and that Fifth Avenue marketing wants to make you think that it is. They want to sell a drug. They want to give you something. But the problem is that it further suppresses everything else, so you're not feeling anything. And the patient will say, well, as long as I take this, this, and this, I feel fine.
It doesn't bother me.
It doesn't bother me. Yeah.
It still hurts you.
It still hurts them. They still have the lump in the throat. They say, well, I throw up all the time, and my doctor says I must have GERD. Well, we just talked about that diaphragm, and if that diaphragm isn't cooperative and supportive to the stomach area, it allows that food to be trapped, and it begins to push its way back up into the esophagus.
Or you get something worse like a sliding hiatal hernia, which are easy to fix.
That's the other subject. Because the diaphragm is stuck, so to speak, when you breathe in and you breathe out, the stomach pushes up against it. It doesn't give. And now it starts pulling at the opening, the hiatus, and it begins to tear it. And you get a bulging first, and then you get a tearing of the fibers. And then you end up in the doctor's office, and end case scenario, say, well, you have a massive hiatal hernia, we've got to go in and we have to cut it and resew it and so forth. And it makes me crazy because nobody is paying attention to function. Normal function is where it needs to be.
It's hard not to laugh when you hear that, because it's it's relatively simple to fix. It's easy to do, and you fix it a handful of times and it's done.
This Wednesday evening, Dr. Leonard Poe will be your host at the Roselle Center for Healing. We'd like to have you as our guest as he discusses the topic of GERD, gastroesophageal reflux disease. If you've had heartburn, you're on antacids, you're on Pepcid, you're on any of the protein pump blockers, this is an opportunity for you to really find out how to get rid of those things and get your life back. Change the environment of your body so you can begin to absorb calcium, you can begin to get the protein back, you can begin to absorb your minerals and your B12 and so forth. Give our office a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. As always, our in-house continuing education programs are free to you, but we do require a reservation because once we're full, and we're not going to be able to seat you. So please give us a call, 703-698-7117. Dr. Leonard Poe will be your host this Wednesday evening, April the 6th at 7:30 p.m. We'd love to have you. We'd love to discuss the problem. We'd love to fix it for you and make a huge difference. But trust me, if you attend, you're going to learn a whole lot.
Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com. Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor.